Good morning, guys. My God, I've had an awful night. An awful morning. My bowels have been getting into overdrive. My anxiety is really bad because yesterday I got this through the post. So, I got an appointment letter for, it says surgical endoscopy next Wednesday morning. And I am having a lower gastrointestinal endoscopy. Now, an endoscopy, to my knowledge, is down the throat. But no, it's not down the throat, it's up the bum. I can't tell you how many times I have had this procedure. Now, haven't had it in a long time. I've had it loads of times, but I haven't had it in a long time. And this just really set my anxiety over the wall since yesterday, and trying my hardest not to worry about it. But like I said before, it doesn't matter how many times you've been through medical procedures, it never gets any easier. The lovely friendly leaflet to tell me what to expect. Now, the first bit that annoyed me was it saying I'm having an endoscopy, but when I look through the booklet it says that it's a colonoscopy, which is up the bum. So basically information just telling me about my hospital stay, but I won't be staying overnight. It's just a couple of hours depending on how long they take to get to me, and if I choose whether to be sedated or have another form of medication, which is like gas and air that they give to women during labour. And I've never had this, so personally I don't know if it's a good idea. Like, my niece is a midwife and she's advised that I don't do it, because it's not really a pain relief and it just gives you like a drunk feeling. But I spoke to my mum about it when she was in labour with me, and she said she had a great time with it. But I don't think this is the right opportunity to take that chance, because I want to be as comfortable as possible and hopefully not feel anything. So basically it tells you about what's going to happen through the whole day. So about your hospital stay before admission, when they take you through in the hospital bed, and your bowel preparation. But luckily this time for me, I don't need to do any bowel preparation. So this is usually followed by an enema or a horrible disgusting drink, and I don't need to do either. And I think it's because it's just the lower part that they're looking at, and I think it's just like the rectum area. It's quite interesting because I phoned up the unit yesterday because I was so confused. I was like, why am I getting this procedure? Like, I seen my Crohn's consultant a week or two ago and this was never discussed, and plus that would have been far too early for an appointment. But they said it was made back in January from the first Crohn's consultant that I seen, because I've seen 2 different ones in 6 months. And I was just a bit taken back by it, because in that appointment I did say to the consultant that I think it's a good idea that we do this procedure because I've had my stoma bag for 10 years, and after your rectum has remained dormant for over 5 years, you're at more risk for getting rectal cancer, especially in young people, because unfortunately it's getting more common in young people. So anyway, I says to him about the procedure and he just outright said no. And to be honest, I wasn't really happy with the appointment. I didn't feel like I was being listened to, and I felt like there was like a bit of, I don't know, arrogance, ignorance, and most of the time he was sitting on the computer trying to catch up with my medical records. But to be honest, I've got my medical records in my kitchen drawer, and there's 3 boxes full, and they're like that thick. I just would have thought that maybe they would have done that before the appointment, but oh well, maybe they didn't have time. So the consultants went and changed his mind, and don't know why. Maybe he was listening, I don't know, or maybe had a look at my records and he's like, oh no, we need to do this. So really I asked for this. But despite how scary this procedure is, guys, I know I need to do it. And I'm probably going to end up being really anxious considering how I was yesterday. And probably going to get really upset like I did yesterday. And yeah, it never gets any easier. So, just in case anybody hasn't had this procedure before, or if you're waiting for one, I'm just going to go over some bits and pieces, again for awareness and education, because it's needed. And you know me, I'm really open about my health journey and stuff. So what's going to happen during the test if you're having a lower examination, okay? So they'll take you to the examination room on a trolley, like a bed, and you'll meet the endoscopist, if that's how you say it, and the nurses who will be responsible for your care, you know, throughout the procedure. And they'll ask you to lie on your left side with your knees slightly bent. And this is when they put the camera in. So when you're comfortable lying the way you are, they will give you a sedative injection, which is an IV, a cannula in your hand, so it goes straight to your veins, so it works instantly. Although I'm quite worried about this because my body has got quite a high tolerance to, you know, medication, and I will be making them aware of this. And I know that can be a bit embarrassing to admit sometimes, guys, but trust me, you need to always be honest with your medical team, always. But anyway, this will make you feel sleepy and relaxed. But now they've also got a second option, and this is the gas and air that women use when they're giving birth, okay? So it's an alternative, I can't speak, rather than getting, you know, intravenous sedation and pain relief given before the colonoscopy. So it's commonly used to provide pain relief during labour and childbirth, and even during dental treatment. I can't speak this morning. It's also used during investigative treatments such as colonoscopy, where pain relief is required. You need to make sure that the nurse is aware of any medical conditions that you have and medications that you're taking. Like the nurse told me yesterday morning that I won't be allowed to take my codeine in the morning before I go for this procedure, but I can take my anti-sickness, which I think would maybe be a good idea for sickness, but that's also a sedative medication. So yeah, I'll need to speak to them about that. So the camera is really flexible, and I think it's about that thick, and it goes inside. From my last couple of experiences with, you know, the injection, I was in and out of sleep. I could still hear and see things, but I can't remember if I could feel things. I think I could a wee bit, but and they fill you up with so much air in your bowel so they can get a better look. So this means that you're going to have a lot of trapped wind, but as soon as they take you back through, you'll start passing that out through your back end or through your stoma bag. So if you've got a stoma bag, you'll need to lie with your stoma bag open. And if you're going to get the sedation, you can't leave the hospital for 3 hours, and you have to have somebody there at the hospital and with you for a whole 24 hours. But if you get the gas, you can just go home immediately and drive or whatever. So yeah, guys, I haven't got time to read this all to you, and I don't want to bore you, but I will be getting this done next Wednesday morning, and I will keep you up to date before and after with whatever I can, because obviously I won't be allowed to film during the procedure. But I think I will be going for the sedation, the best option to knock me out. And then I've also, 2 days after that, I've also got another MRI scan. Flying in, aren't they? Hospital, hospital, hospital. They always go, guys, when you've got Crohn's and colitis. Your health is wealth. These procedures are done for a reason. Do not miss anything just because you're scared. They can do things to help you. Please just look after yourselves and wish me luck that everything comes back safe. And can continue on with my life being happy and healthy.